Every single week, I have patients walk into my cardiology practice who survived a heart attack and ask me the same question. Doc, I thought I was doing everything right. I ate my oatmeal, I took my morning walk, I even switched to decaf. How did this happen? And when I walk them back through their typical morning routine, when I ask them to describe the first 90 minutes after they wake up, that's when the picture becomes crystal clear. Because the heart attack didn't happen because of what they ate for dinner. It happened because of what they did every single morning for the past 10, 15, sometimes 20 years. The habits that feel harmless, the routines that seem healthy, the morning rituals everyone recommends, many of them are silently, systematically destroying your cardiovascular system. And here's what nobody tells you. The first 2 hours after you wake up are the most dangerous window for your heart. That's not an exaggeration. That's documented cardiovascular science. Heart attacks peak between 6 a.m. and noon. The highest concentration occurs between 8 and 10 a.m. That pattern isn't random. It's physiological. And the habits you practice during that window either protect you or push you closer to a cardiovascular event. I'm Dr. Nathan Brooks. I've spent 17 years in interventional cardiology. I've performed over 3,000 cardiac catheterizations. I've placed stents in arteries that were 90% blocked. I've restarted hearts that stopped beating. And I can tell you this with absolute certainty. Most of the damage I see, most of the blockages I clear, most of the emergency procedures I perform at 3 in the morning, they started with morning habits that nobody questioned. Subscribe and hit the like button right now, because what you're about to hear, you will not get from your annual physical. The system is built to treat heart attacks, not prevent them. There's no billing code for teaching you how to wake up correctly. There's no reimbursement for explaining what happens to your cardiovascular system in the first hour of the day. That's exactly why this channel exists. Help Dr. Nathan Brooks reach 100,000 subscribers so we can get this information to the people who need it most before they end up in my cath lab. So let's start with the foundation. Why are mornings so dangerous for your heart? Why does the risk spike so dramatically in those first few hours after you open your eyes? Because your body undergoes a series of profound cardiovascular shifts the moment you transition from sleep to wakefulness. These changes are measurable, predictable, and in people over 50, they are the difference between waking up healthy and waking up in crisis. The first change, your blood pressure surges. During deep sleep, your blood pressure drops by 10 to 20%. This is called nocturnal dipping, and it's completely normal. It gives your cardiovascular system a chance to recover from the demands of the day. But the moment you wake up, your sympathetic nervous system, that's the part of your automatic nervous system that controls your fight-or-flight response, it kicks into gear. Cortisol, your primary stress hormone, spikes by 50 to 60% within the first 30 minutes of waking. That cortisol surge drives your blood pressure up rapidly. In some people, systolic pressure, that's the top number, can jump by 20 to 30 points in the first hour alone. Now, if your arteries are young, flexible, and clear, that surge is manageable. But if you're over 50, if you have any degree of atherosclerosis, that's the hardening and narrowing of the arteries due to plaque buildup. If your vessel walls have lost elasticity, that sudden pressure spike is a stress test your cardiovascular system may not pass. The second change, your blood becomes more prone to clotting. During the night, your body increases the concentration of platelets, the small cell fragments that form clots, and it increases the activity of clotting factors in your bloodstream. This is an evolutionary mechanism. If you were injured during sleep, your body needed to be ready to stop bleeding quickly. The problem is, in modern humans with plaque-filled arteries, that same clotting mechanism can trigger a thrombus, a blood clot that forms inside a vessel. If that clot lodges in a coronary artery, one of the vessels that supplies blood to your heart muscle, you have a myocardial infarction, a heart attack. The third change, your heart rate accelerates. Resting heart rate during sleep can be as low as 50 to 60 beats per minute. Upon waking, that rate can jump to 70, 80, even 90 beats per minute or higher depending on what you do in those first few minutes. That acceleration increases myocardial oxygen demand, meaning your heart muscle suddenly needs significantly more oxygen. If blood flow can't keep up because of narrowed arteries, the heart muscle starts to suffer. That's called ischemia, inadequate blood supply to the tissue. Prolonged ischemia leads to infarction, tissue death. The fourth change, your autonomic nervous system shifts from parasympathetic dominance, the rest and digest mode, to sympathetic dominance, the fight-or-flight mode. That shift triggers the release of adrenaline and noradrenaline into your bloodstream. These hormones make your heart beat harder and faster. They constrict certain blood vessels. They mobilize glucose and fatty acids into your bloodstream to fuel immediate activity. In a healthy cardiovascular system, this transition is smooth. In a compromised system, it's a trigger. And here is the critical point. Every one of these changes, the blood pressure surge, the clotting activation, the heart rate spike, the adrenaline release, every single one is amplified or dampened by what you do in the first 90 minutes of your day. The research is unambiguous. Certain morning habits turn that vulnerable window into a death trap. And most people practice at least 3 or 4 of them without knowing it. Let's go through the 7 most dangerous morning habits I see, starting with habit number 1. You wake up and immediately jump out of bed. This is the single most common mistake I encounter. The alarm goes off. You sit up fast. You swing your legs over the side of the bed. You stand up. You start moving. It feels efficient. It feels like you're seizing the day. What it actually does is shock your cardiovascular system. Here's what actually happens inside your body when you go from horizontal to vertical too quickly. First, gravity instantly pulls a significant volume of blood from your upper body down into your legs. This is called orthostatic redistribution. In a young, healthy person with responsive blood vessels, the body compensates immediately. The vessels in your legs constrict to push blood back up. Your heart rate increases slightly to maintain circulation. Blood pressure stabilizes within seconds. But after 50, that compensation system slows down. The baroreceptors, specialized sensors in your blood vessels that detect pressure changes, become less sensitive. The vessels themselves are stiffer and slower to constrict. The result is orthostatic hypotension, a sudden drop in blood pressure when you stand up. You might feel lightheaded. You might feel nothing at all. But your brain and your heart are briefly starved of optimal blood flow. Second, that sudden postural change triggers a reflex adrenaline spike. Your body perceives the rapid blood pressure drop as a threat and releases stress hormones to correct it. Remember, you already have a natural morning cortisol surge happening. Now you're adding another adrenaline jolt on top of it. That combination is what cardiologists call a sympathetic storm, an excessive activation of your fight-or-flight system. In someone with vulnerable coronary arteries, that storm can destabilize existing plaque and rupture it. A ruptured plaque is what causes most heart attacks. Third, if you have any degree of dehydration from the overnight hours, and almost everyone does, your blood volume is already reduced. Standing up fast with reduced blood volume makes the orthostatic effect even worse. Your heart has to work significantly harder to maintain pressure and flow. For a compromised heart, that extra work in the first 60 seconds of the day can be the final stressor. The solution is absurdly simple, and it costs you nothing but 60 seconds. When you wake up, stay lying down for 15 to 20 seconds. Let your brain fully wake up. Then sit up slowly and stay seated on the edge of your bed for another 30 to 40 seconds. Let your cardiovascular system adjust to the postural change gradually. Then stand up. That's it. 1 minute of gradual transition can eliminate one of the highest risk moments of your entire day. Habit number 2. You check your phone within the first 5 minutes of waking up. You reach for it before you even get out of bed. You scan emails. You check the news. You scroll social media. Maybe you're checking the markets, the weather, your messages. It seems harmless. You're just gathering information. What you're actually doing is activating your body's acute stress response before your cardiovascular system is ready to handle it. Let me explain the physiology. When you look at your phone and see anything that triggers a psychological response, an upsetting email, bad news, a provocative headline, an argument in the comments, your brain's amygdala, the emotional processing center, fires a threat signal. That signal activates your hypothalamic pituitary adrenal axis, the HPA axis, which triggers a flood of cortisol and adrenaline. Your heart rate jumps. Your blood pressure spikes. Your blood vessels constrict. Glucose pours into your bloodstream. Your body is preparing to fight or run even though you're sitting in bed. Now layer that on top of the natural cortisol awakening response that's already happening. You've just created a double stress surge. Studies using continuous heart rate monitors and blood pressure cuffs show that people who check their phones immediately upon waking have measurably higher blood pressure and heart rate in the first 30 minutes of the day compared to people who wait. That difference averages 8 to 12 points systolic and 10 to 15 beats per minute. That might not sound like much, but in someone with underlying coronary artery disease, that spike is enough to shift stable plaque into unstable territory. There's a second mechanism at play. The blue light from your phone screen suppresses melatonin, the hormone that regulates your sleep-wake cycle, and it stimulates cortisol production. Even if the content you're viewing is neutral, the light exposure itself is a biological stressor in the early morning. The solution requires discipline, not money. Leave your phone across the room or in another room entirely. Do not touch it for the first 30 minutes after you wake up. Use an actual alarm clock if you need one. Give your cardiovascular system time to transition from sleep to wakefulness without adding a psychological stressor. After 30 minutes, when your blood pressure has stabilized and your autonomic nervous system has settled into daytime rhythm, you can check your phone. The emails will still be there. The news will still be there. The difference is your heart will be in a state to handle it. Habit number 3. You drink coffee on an empty stomach as your first beverage of the day. You wake up. You make coffee. You drink it black, maybe with a little cream, and you feel like you're doing the right thing because you've heard coffee is good for your heart. And to be clear, moderate coffee consumption, that's 2 to 3 cups per day, has been associated with reduced cardiovascular risk in large population studies. But timing matters. And drinking coffee first thing, before any food or water, triggers a cascade of effects that stress your heart. Here's what actually happens. Coffee contains caffeine, a stimulant that blocks adenosine receptors in your brain and triggers the release of dopamine and adrenaline. That's why it wakes you up. But adrenaline also raises your heart rate and blood pressure. One study measured an average increase of 5 to 10 points in systolic blood pressure and 5 to 7 beats per minute in heart rate within 30 minutes of drinking coffee. Again, in isolation, that's manageable. But you already have a natural morning blood pressure surge. You already potentially have a phone-induced stress spike. Now add coffee. You're stacking stimulants. Second, coffee stimulates the production of stomach acid. On an empty stomach, that acid has nowhere to go. It irritates the stomach lining and can trigger acid reflux. Chronic acid reflux is not just uncomfortable. It's been linked in multiple studies to increased sympathetic nervous system activity and higher resting heart rate. The mechanism isn't fully understood, but the association is real. Third, caffeine on an empty stomach causes a sharper, faster spike in blood caffeine levels compared to drinking it with or after food. That sharper spike means a sharper cardiovascular response. Your heart doesn't like sharp changes. It prefers gradual adjustments. Fourth, coffee is a diuretic. It increases urine production. If you're already mildly dehydrated from the overnight hours, coffee makes that worse. Dehydration reduces blood volume, which forces your heart to pump harder to maintain circulation, especially in the morning when blood pressure is already unstable. The fix is simple. Drink 8 to 12 ounces of plain water first. Wait 15 to 20 minutes. Eat something small, even just a handful of nuts or a piece of fruit. Then have your coffee. By rehydrating first and putting a small amount of food in your stomach, you blunt the cardiovascular spike and you give your body a buffer. You still get the cognitive benefits of caffeine, but you eliminate the unnecessary cardiac stress. Habit number 4. You take a hot shower immediately after waking up. This is another habit that feels healthy, that feels invigorating, but creates significant cardiovascular strain. Hot water causes peripheral vasodilation, meaning the blood vessels near the surface of your skin expand to release heat. That expansion pulls blood away from your core and your vital organs. To maintain blood pressure, your heart has to pump harder and faster. In a healthy cardiovascular system, that's not a problem. But in someone over 50 with any degree of arterial stiffness or compromised cardiac function, a hot shower in the morning while your blood pressure is already spiking can overload the system. I have had patients, more than a dozen, who experienced angina, chest pain due to reduced blood flow to the heart muscle, or even full cardiac events in the shower. The temperature shock also matters. If you go from a cool bedroom directly into a hot shower, the rapid temperature change triggers a sympathetic reflex. Blood pressure jumps. Heart rate accelerates. If you already have compromised coronary arteries, that reflex can reduce blood flow to the heart at the exact moment the heart is working harder. That mismatch, increased demand plus reduced supply, is the setup for ischemia. The solution is not to skip showering. It's to adjust the timing and the temperature. Wait at least 30 minutes after waking before you shower. Give your cardiovascular system time to stabilize, and turn the water temperature down. Warm, not hot. If you can comfortably keep your hand under the stream without pulling it away, that's the right temperature. After you adjust to that routine, you'll notice you feel better, not worse, and your heart will thank you. Habit number 5. You skip breakfast or eat a high-sugar breakfast. Both extremes create cardiovascular problems, just through different mechanisms. Let's start with skipping breakfast. Entirely. When you sleep, you fast. For most people, that's 7 to 9 hours without food. By the time you wake up, your liver's glycogen stores, the stored form of glucose, are partially depleted. Your body needs fuel. If you don't eat, your body enters a mild stress state. It releases cortisol and adrenaline to mobilize stored energy. Those stress hormones raise blood pressure and heart rate. You're adding another layer to the morning cardiovascular surge. Multiple studies, including data from the Framingham Heart Study, show that people who regularly skip breakfast have a significantly higher risk of heart attack and stroke compared to people who eat breakfast consistently. The mechanism involves not just the stress hormone release, but also increased platelet aggregation, meaning your blood is more likely to clot, and impaired endothelial function, meaning the inner lining of your blood vessels doesn't work as well. Now let's talk about the other extreme, a high-sugar breakfast. Donuts, pastries, sugary cereal, white bread with jam, orange juice, even flavored yogurt. All of these cause a rapid spike in blood glucose. In response, your pancreas dumps a large amount of insulin into your bloodstream to bring glucose levels down. That rapid insulin spike triggers inflammation and oxidative stress throughout your vascular system. It also increases sympathetic nervous system activity. Heart rate goes up, blood pressure goes up. And in people with insulin resistance or prediabetes, both extremely common after 50, that inflammatory response is even more pronounced. High-sugar breakfasts also impair something called flow-mediated dilation, which is the ability of your blood vessels to expand in response to increased blood flow. When flow-mediated dilation is impaired, your vessels can't adapt to changing demands, and your heart has to work harder. Studies show that a high glycemic breakfast reduces flow-mediated dilation by up to 20% for several hours after eating. The solution is to eat a balanced breakfast within 60 to 90 minutes of waking up. That breakfast should contain protein, healthy fat, and fiber, eggs with vegetables, Greek yogurt with nuts and berries, oatmeal with almond butter and cinnamon, avocado toast on whole grain bread. These combinations provide sustained energy without spiking blood sugar, and they support stable blood pressure and heart rate throughout the morning. You're not just feeding yourself, you're protecting your cardiovascular system during its most vulnerable hours. Habit number 6. You exercise at high intensity first thing in the morning without a proper warm-up. Exercise is essential for cardiovascular health. I recommend it to every single one of my patients. But high-intensity exercise immediately upon waking, especially without preparation, is one of the riskiest things you can do. And yet I see people doing it all the time. They roll out of bed, lace up their running shoes, and go straight into a hard run or a HIIT workout or heavy lifting. Here's the problem. Your muscles are cold. Your joints are stiff. Your cardiovascular system is still in the transition phase. Your core body temperature is lower than it will be later in the day. Your nervous system has not fully shifted from parasympathetic to sympathetic tone. All of that means your body is not ready for intense demand. When you go from rest to maximum effort in a matter of minutes, you force your heart to spike its output dramatically while your coronary arteries are not yet fully dilated. Blood flow to the heart muscle can't keep up with the oxygen demand. That mismatch creates ischemia. This is not theoretical. There is well-documented evidence that the risk of sudden cardiac arrest during exercise is highest in the early morning hours, and it's highest in people who go from zero to maximum intensity without a warm-up. The combination of the natural morning cardiovascular surge plus sudden exercise intensity creates a perfect storm. The solution is straightforward. If you exercise in the morning, and I encourage you to, build in a proper warm-up. Spend the first 10 to 15 minutes at low intensity. Walk before you run. Do dynamic stretches before you lift. Let your heart rate rise gradually. Let your blood vessels dilate progressively. Let your body temperature increase. After that warm-up period, your cardiovascular system is ready. Then you can increase intensity safely. The warm-up is not wasted time. It is life-saving preparation. Habit number 7. You take your blood pressure medication inconsistently or at the wrong time. If you're on medication for hypertension, high blood pressure, or for any cardiovascular condition, timing and consistency are not optional details. They are the difference between the medication working and the medication failing. And yet I see people skip doses, take medications at random times, or take them on an empty stomach when they're supposed to take them with food. Here's why this is so dangerous in the morning. Blood pressure medications are designed to smooth out your cardiovascular response over 24 hours. Most of them are dosed once daily, and they're designed to be taken at the same time every day. If you skip a dose or take it late, you lose that protective coverage during the exact window when your blood pressure naturally surges. You've essentially turned off your safety system during the highest risk hours. Some blood pressure medications, particularly beta blockers and ACE inhibitors, work best when taken in the morning because they blunt the morning surge. Others, like certain calcium channel blockers, work better when taken at night. Your cardiologist prescribes timing based on your specific situation. If you're not following that timing, you're not getting the benefit. Taking medication inconsistently also creates what we call rebound effects. When you skip a dose and then take the next one, your blood pressure can swing up and down instead of staying stable. Those swings put stress on your vessel walls and increase the risk of plaque rupture. Stable blood pressure protects you. Variable blood pressure damages you. The fix requires a system, not just intention. Set a daily alarm on your phone. Use a pill organizer so you can see at a glance whether you've taken today's dose. Take your medication at the exact same time every single day. If your prescription says take it with food, eat something first. If it says take it on an empty stomach, respect that. These details matter more than most people realize. Your medication only works if you take it correctly. Now, here's an important clinical point that ties everything together. All 7 of these habits carry exponentially more risk if you're over 50, if you have a family history of heart disease, if you have high blood pressure, high cholesterol, diabetes, or if you're overweight. Because each of those factors reduces your cardiovascular reserve, your body's ability to absorb stress without breaking down. The same morning habit that a 30-year-old's heart can tolerate without issue can trigger a cardiac event in a 60-year-old with underlying disease. How old are you? Write your age in the comments. I want to know who's watching. What age group is most concerned about this so I can create content that speaks directly to where you are in your cardiovascular journey. Now let me give you a clear, practical, step-by-step morning routine that eliminates all 7 of these risks and protects your heart during its most vulnerable window. Here is exactly what to do starting tomorrow morning. 1. When your alarm goes off, stay in bed for 15 to 20 seconds. Open your eyes. Take a few deep breaths. Let your brain fully wake up. Then sit up slowly. Sit on the edge of your bed for 30 to 40 seconds. Notice how you feel. Then stand up. That's your cardiovascular warm-up. It costs you 1 minute and it eliminates orthostatic stress. 2. Do not touch your phone for the first 30 minutes. Leave it in another room if you have to. If you need an alarm, buy a simple alarm clock for $10. Use those first 30 minutes for your morning routine, bathroom, water, breakfast prep, whatever you need. No email, no news, no social media. Give your nervous system a chance to wake up without a stress trigger. 3. Drink 12 to 16 ounces of plain water within the first 10 minutes of waking up. Keep a glass or a bottle on your nightstand and drink it before you do anything else. This rehydrates you, increases blood volume, and prepares your body for the day. Water first, always. 4. Eat a balanced breakfast within 60 to 90 minutes of waking. Protein, healthy fat, fiber. If you're taking blood pressure medication or any cardiovascular medication, take it at the exact same time every single morning, with or without food as prescribed. Set an alarm, make it automatic. 5. If you drink coffee, and you can, drink it after you've had water and food. Not before. Not instead of after. That timing blunts the cardiovascular spike and gives you the benefits without the risk. 6. If you shower in the morning, wait at least 30 minutes after waking and use warm water, not hot. If you prefer hot showers, save them for the evening. Morning showers should be warm and brief. 7. If you exercise in the morning, build in a 10 to 15-minute low-intensity warm-up before you increase effort. Walk before you run, move before you lift. Let your heart rate rise gradually. Your body will perform better and your heart will stay safe. That's it. 7 habits replaced with 7 safer alternatives. None of them require expensive equipment. None of them require extra time, not really. What they require is awareness and consistency. Small changes in how you structure your first 90 minutes produce dramatic reductions in cardiovascular risk. I've seen it in my practice hundreds of times. Patients who adopt this routine report feeling better, having more energy, and when we monitor their blood pressure and heart rate, the numbers prove it. Smoother mornings, safer mornings, healthier mornings. Your morning routine is not a trivial lifestyle detail. It is a medical intervention. The first 2 hours of your day set the tone for your entire cardiovascular system. Protect those hours and you protect your heart. Ignore them and you're rolling the dice every single day. Nobody is going to teach you this at your next cardiology appointment. There isn't time. There isn't reimbursement. The system is built to react to heart attacks, not prevent them. That's why I built this channel, to give you the information that should be standard care but isn't. Subscribe to Dr. Nathan Brooks. Leave a like on this video. Help us reach 100,000 subscribers so we can reach people before they need a stent, before they need bypass surgery, before they become a statistic. One informed person at a time, we can change the trajectory of cardiovascular disease. Your heart is counting on you to get this right. Start tomorrow morning.